Do your legs ever feel heavy, achy, or swollen by the end of the day? Have you noticed bulging varicose veins or swelling around your ankles that seem to get worse if you've been standing for hours? This is my field of expertise. This is what I do every single day. A lot of people brush these things off as just getting older or just being on your feet too long, but the truth is these could be early warning signs of chronic venous insufficiency, or what we call chronic venous disease, CVI or CVD. And this is a condition where the veins in your legs aren't working the way they should. The little valves have failed. And trust me when I tell you, this is not just about appearance. This is a serious and significant vascular problem. While varicose veins might look cosmetic, and in some ways they are, if they're untreated, venous insufficiency can lead to very serious complications that I take care of every single day in my office and have been doing for nearly 20 years. It can lead to painful ulcers, it can lead to skin infections, and even long-term disability with problems walking, infection, sepsis, cellulitis. It is a big deal, and that's why I make these videos again and again to raise awareness. The good news is that the condition is both common and very treatable. The other important news is that you have to get in the hands of somebody who really knows what they're doing. Millions of people live with venous insufficiency, and with the right steps and the right treatment, you can dramatically reduce the symptoms and prevent progression. That's really key. In chronic venous disease, it's important to know that it's a chronic, progressive disease. It's not curable, but it's treatable, it's manageable, and you can maintain good health, especially if you catch it early. In today's episode, I'm going to break down for you what venous insufficiency really is, the most common causes, the symptoms that you should never ignore, and of course, the best treatment options. And we're going to talk about lifestyle strategies as well as everything going all the way up to advanced procedures. And definitely stay with me until the very end, because that's when I'm going to share with you the most effective lifestyle changes that improve circulation in your legs. And these are backed by research and decades of clinical experience, and in my case, personal clinical experience. So to understand venous insufficiency, you first have to know how veins normally work and what they are. Let's begin with the other subject, your arteries. Your arteries are the blood vessels that carry oxygenated blood from your heart to your organs, to your body, up to your brain, to your arms, your legs, every area of your body, all of your internal organs, everything. Oxygen keeps us alive. So the arteries are essential. That's a different subject we'll have on another day, peripheral arterial disease, when there are blockages in the arteries. But normally, oxygen-rich blood is bringing oxygen and other nutrients to your cells to keep them alive. Now, on the other hand, you have veins. This is extremely important. The veins bring blood back to your heart. That's the venous return, the blood return to the heart. Extremely important. Why? Because we have a circulation. They call it a circulation because the blood travels in a circle. Out from the heart, back to the heart. Out from the heart, back to the heart. There's a third element, the lymphatics. We're not going to talk much about that today, but I have other videos on that extremely important part of the circulatory system. So the veins bring the blood back up to the heart after they've unloaded the oxygen. It's deoxygenated blood. It's what we call the blue blood. Here's the challenge. How the heck does blood get back from your feet and your legs up to your heart against gravity? It's really a very neat trick. How does it happen? Veins are equipped with these tiny little one-way valves. I call them like butterfly wings. I've operated on many veins, opened the vein delicately. It's called a venotomy. You can look inside with my magnifying glasses when I'm in the operating room, and you see these very, very delicate, beautiful structures, one-way valves, similar to the valves in your heart, but much, much tinier, much more delicate. And those valves, with every single step they take, with the calf muscle contraction, those valves open and close. A one-way check valve. They open, blood goes up toward your heart, they close nice and tight, and the blood cannot come down with gravity. Your calf muscle acts like a pump, squeezing the veins and pushing the blood upward. The valve snaps shut in between those squeezes, preventing the blood from flowing backward in the reverse direction, what we call regurgitation or reflux, back down the leg. Now, in chronic venous insufficiency, or CVI, also known as chronic venous disease, CVD, those little valves no longer work the way they should. And rather than opening and closing nice and tight, open wide open, close nice and tight, they become damaged and they flop back and forth like saloon doors. In fact, they can become so inflamed and damaged that they get gobbled up. And so the vein walls are there like that, and there's absolutely no valve in between. It becomes like an open pipe, and gravity can just pull that blood right down the leg. Sometimes the damage to the valve is from a previous blood clot, especially in the deep system, but that can happen in the superficial system as well, from what we call phlebitis. Sometimes it's just genetic. It runs in families. Again, the result is that the blood leaks backward. We call them leaking valves or leaking veins. You'll hear them referred to. And then what happens is the blood pools in the leg instead of moving effectively and efficiently up toward your heart. Over time, that backup of blood causes pressure to build in the veins, and those veins dilate and they stretch and they get big, and they have high blood pressure within them, what we call venous hypertension. And that leads to swelling and heaviness and aching of the muscles, and it causes problems with the skin. Eventually, you'll see visible varicose veins form on the surface of the skin. And that's not always the case, but often that's a great warning sign. In plain English, you can think of this analogy. Think of your veins like plumbing pipes in a very tall building, and the valves are like elevators that help bring that blood back up to the heart in one direction only. But if those doors get stuck in the open position, the elevator doors get stuck in the open position, the elevator car is going to fall right down to the bottom of the shaft. So it's a very, very good analogy. And the blood isn't always moving where it should be. And when this happens, when blood goes backwards, it's never good in the human body. If that happens in a heart valve, the blood backs up into the lungs and you get fluid overload in the lungs. You can't breathe. You're suffocating in your own secretions, of what we call congestive heart failure. When that happens in the leg becomes swollen and edematous and very, very sick. Something that I've called congestive lower extremity failure. It's a new concept that I published on last year, as a matter of fact. So when we say venous insufficiency, what it really means is that the circulation system is insufficient and the leaky valves are causing overload in the legs, and that pressure can cause tremendous problems down the road. So why do some people develop venous insufficiency while others don't? Well, there are several key risk factors and causes. Some you can control and others you definitely can't. The first thing is genetics. A family history is one of the biggest predictors. And as a vascular surgeon specializing in venous disease, I see patients who have this running in their family for generations. In fact, I've had patients in my own practice that it's grandparents, parents, and children, going as young as people in their teenage years and as old as people up into their 90s. So in my own practice, I can see the genetic hereditary effect. It's very, very dramatic. If your parents or your grandparents had varicose veins or leg swelling, you're more likely to develop it too. It doesn't mean you will, but you're more likely, and it's something you should be aware of. Some people are simply born with weaker vein walls or valves. This can be a function of their connective tissue and, again, their genes. The second thing is age. As we get older, just like anything else in the human body, unfortunately, things start to wear out. Parts wear out. Think about the valves in the engine of a car. You have so many opening and closing and opening and closings in the course of the lifetime of a car or a heart valve or a leg valve. Things just wear out, especially delicate things like leg vein valves. So that's where venous insufficiency becomes more common after the age of 50. We certainly see it in younger people, especially with strong genetic predisposition, but just being on your feet and even sitting upright for many years is a huge risk factor for developing venous insufficiency. The other thing is gender and hormones. There's no question that women are more likely to develop venous insufficiency, but I can tell you from personal experience, men get venous insufficiency and varicose veins a lot. I would say in my practice, it's probably about 55%, maybe 60% women and 45% men, something like that. It's not a dramatic difference. It's certainly not 80-20 or 70-30. We see a lot of men, and the problem with men in venous insufficiency is oftentimes they get picked up late because when they're younger, they're kind of macho and they ignore it. And in some cases, they even think the veins look cool or, again, macho, and they put things off until they run into complications. So a lot of times men can come with more advanced disease and with complication of disease. Another risk factor is pregnancy. pregnancy. As many of you know who follow my channel, my father was an OBGYN and he saw a lot of varicose veins and venous problems in pregnant women, especially with advanced pregnancies, meaning the third and fourth pregnancy and beyond. Pregnancy increases the risk not only from a pressure point of view because the uterus is expanding in the pelvis and pressing on the iliac veins, the big veins in the pelvis that start leading up to the vena cava and to the heart, but also because of hormonal changes that occur during pregnancy. Another thing that's important is birth control and hormone replacement therapy. This can potentially weaken vein valve walls, and it can also lead to blood clot formation, which is another thing to be very, very cautious of and be aware of. Another risk factor would be obesity and lifestyle. Carrying extra weight puts more pressure on the veins in your legs and in your pelvis. Actually, a huge abdomen can push down on the big veins that are low pressure in the abdominal cavity and actually flatten them and squash them and compress them. It's a very real thing, and it's something to be aware of in terms of managing your weight, like so many of the diseases that we talk about here on my channel. Again, standing is bad, but the other thing you have to recognize is that sitting, even in the position that I'm in, my right atrium, the right side of my heart, is sitting almost directly above my ankles. And so that's causing a pressure gradient. That's what we call hydrostatic pressure. And so gravity is pulling all that blood down toward my feet and ankles, and there's very little way for it to return. Interestingly, when I'm sitting like this and I'm not walking and using those calf muscle pumps, you say, well, how in the world is blood getting back to your heart when you're sitting still or you're standing still? And the answer is very interesting. It's from breathing. Believe it or not, each time I take a deep breath like that, my chest is expanding and my diaphragm is lowering, and it's creating a bellows effect. It's literally creating a vacuum, a negative pressure that pulls that blood back up to the right side of my heart. So that's the only way that blood returns to the heart when you're not actually in motion. It's through breathing. And so breathing is key to the circulation, and the circulation is key to keeping you breathing. So the two things go hand in hand. But sitting and standing for long hours, which most of us do at work now, but you can think about certain professions that are worse: nurses, teachers, hairdressers, retail workers. I see all of these people all the time. I've treated a lot of surgeons, people standing in one spot for hours at a time, as opposed to those who are on the move. In fact, I can't really remember off the top of my head ever taking care of a mailman with venous insufficiency, because the walking is an excellent pump mechanism. Truck drivers are also another frequent visitor to my office because of the long haul sitting in the rig. So whenever that calf muscle pump isn't being used, you're going to be at risk. Another risk factor is having a history of blood clots. This again can be in the deep system, what we call DVT, and that can permanently damage the deep system of valves. Something that we call post-thrombotic syndrome can then form, where because of the damage and the scarring in the deep system of veins, blood is going to pool in the legs, and the outflow from the legs can even be physically obstructed or blocked from the scarring. This is one of the strongest risk factors for venous insufficiency. And again, it can also happen in the superficial veins. Other contributing factors, again, would be multiple pregnancies, lack of exercise, chronic constipation with a lot of pushing and straining, heavy lifting. These can increase intra-abdominal pressure and make it harder for the leg veins to empty and harder for blood to return to the heart. So here's a good plain English analogy. Imagine trying to push water through a straw that's being squeezed from the outside. If the straw is already weakened or damaged, or if there's constant pressure on it, eventually the water doesn't want to move through it the way that it should. And that's what happens when risk factors like genetics, pregnancy, and obesity all combine. The system gets overloaded and starts to fail. So here's a key takeaway. While you can't change your age or your family history, you can take action on things like your body weight, exercise, avoiding long stretches of standing or sitting without movement, and these lifestyle factors make a huge difference in how your veins perform over time. One of the challenges with venous insufficiency is that people often ignore the early symptoms or assume they're just normal part of aging. But catching these things early makes treatment much simpler and prevents complications later on. I always use the analogy of going to the dentist. You always want to go to the dentist where he or she she catches a little cavity that hasn't given you a toothache yet, that might require a little filling, but it's better than a root canal or an extraction or an implant. So whenever we catch things early, it's better. Here are the most common signs to watch for with regard to chronic venous insufficiency and chronic venous disease. Swelling in the feet and ankles. This is usually the first symptom. It tends to get worse as the day goes on, especially if you've been standing or sitting for long hours. Now, some of this is normal, but if it becomes chronic and it becomes progressive, you're going to want to have this looked at, especially if it doesn't get better when you lie down after a while. Many people notice that their shoes begin to feel tight. Another very, very common symptom is a feeling of heaviness or aching in the legs. And that heaviness is not just a feeling. The leg actually becomes heavy because blood is pooling there. Think about picking up a gallon of milk, how heavy fluid is, how heavy liquid is. And remember, your blood is not just water. There's cells, proteins, other elements in there that really make it heavy. So that feeling of heaviness is heaviness. Patients often also describe their legs as feeling tired or have a sense of fullness. This discomfort usually improves with leg elevation or after a good night's sleep, but it returns the next day. The other sign that there might be something significant going on is obviously varicose veins or even spider veins. The varicose veins are enlarged, bulging, twisted, ropey veins. They can be as big as my thumb, and those are pretty obvious that there's something going on. You might even have friends, family, your children ask you, "Mommy, Daddy, what are those? You know, that looks ugly, that looks scary." We hear that all the time in our office, believe it or not, in my practice, that patients' children and grandchildren are the reason that they come for care. And the other thing is spider veins. The spider veins, we also call them thread veins. They're like a little cluster of very, very fine red, blue, purple veins. They can be various colors, various shapes, various distributions. But sometimes that's the only clue that there's high blood pressure in the veins underneath. So don't ignore that. The next thing is skin changes. With ongoing, long-standing high pressure in the veins, the skin, especially around the ankles, can become dry, itchy, discolored, thin, flaky, develop what we call venous dermatitis, venous eczema, something that we call hemosiderosis, which is a brown, brawny discoloration of the skin, inflammation. Any of these skin changes are important. And that brownish pigmentation, what we call hemosiderosis, is from iron actually being deposited in the skin. I call it like a biological tattoo. It's a tattoo that nobody would ever want. And it can be sometimes reversible after treatment, but sometimes it's permanent. And it's a sign of blood pooling in the legs, the iron pigment from the red blood cells leaching into the skin, and that pigment in the skin also sets up a very, very intense inflammatory response. In the most advanced cases, the skin may actually harden and take on a leathery texture or a constricted texture. This is something that we call lipodermatosclerosis. It's a $100 word, I guess, but it's a very fancy way of saying lipo meaning fat, dermato meaning skin, and sclerosis meaning scarring. So you get scarring of the fatty tissue in the skin. Early on, people usually get some swelling. The leg and the ankle expand, but with chronic inflammation, they begin to scar down. So people actually, for a while, think that they might be getting better. But that scarring and that constriction can be very, very extreme so that the ankle actually gets very tiny. That's lipodermatosclerosis. It's a very bad sign, very hard to reverse, and can also lead to an open ulcer, or what we call a venous leg ulcer or venous stasis ulcer. Another important sign is restless legs and night cramps. These are very, very, very common signs, and a lot of primary care physicians will miss these, and they'll tell people to drink tonic water or to take magnesium supplements and things like that. If you have restless leg or night cramps, I strongly advise you to be seen by a venous specialist, a vein specialist, because oftentimes it's from chronic venous insufficiency, and with treatment of the underlying problem, those symptoms will go away. Many patients come into the office complaining of cramping, charley horses, night spasms, even wake them out of sleep, that they have to get out of bed and walk around. Also, of course, restless leg, where you feel like you have to kind of keep kicking your legs under the sheets and under the blankets to feel comfortable. That's your body's way of actually pumping some blood out of those legs that's pooling there. And this is all linked to poor circulation. Again, make no mistake about it. The veins are part of your circulation and your circulatory system, and they're just as important as your arteries. In fact, there are more days lost from work from vein problems than there are from peripheral arterial disease, something that even a lot of vascular surgeons don't know. The next sign, of course, is non-healing sores. Again, those venous leg ulcers. In severe or neglected cases, venous leg ulcers can develop near the ankles, usually on the inside of the ankle, but it can sometimes be on the outside of the ankle, what we call the medial or the lateral malleolus. They can also be higher up on the leg in the front of the shin, but any open non-healing wounds on the legs should be evaluated by a vascular specialist, and especially a vein specialist if it's in the ankle area. These can be painful, they can be very slow healing wounds, and they can really powerfully and negatively affect quality of life. So you want to have those checked out. Again, a plain English analogy here would be to think of your legs like a crowded subway system. At rush hour, the trains or the blood cells are supposed to keep moving, get out of the station and back up to your heart. But if the exit valves aren't working, if they're not a one-way exit valve, then the trains back up on the tracks and the station gets overcrowded and everything slows down. It becomes a big mess. And that's exactly what happens inside the veins as pressure builds up and symptoms like swelling, aching, and skin changes begin to show. So here's a key takeaway. If you notice swelling, heaviness, or visible veins that are getting worse, even spider veins, don't ignore them. These are not just cosmetic changes. They're early warning signs that your veins need attention. Also, if you get a wound on the inside or the outside of the ankle, many people will first go to their primary care doctor or a dermatologist about this. Please see a vein specialist. Now, the next thing I want to talk to you about is diagnosis. So what happens when you go to your doctor with leg swelling, heaviness, visible varicose veins? How do we actually diagnose the venous insufficiency? The process is usually very straightforward, especially if you go to see a specialist in vein health or vascular health. First, the doctor is going to take a full medical history and do a physical examination. If they don't, find another doctor. Your doctor will start by asking you about your symptoms, when they started, how long they've persisted, what makes them worse. Are they worse with standing? Are they worse with walking? Generally speaking, vein patients feel better when they walk because they pump the blood back out of the legs up to the heart. On the other hand, arterial patients, patients with blockages in the arteries, or PAD, peripheral arterial disease, they feel worse when they walk because they can't get enough oxygen to those big muscles. So they get muscular pain, just like somebody would get chest pain in their heart muscle when they can't get enough blood flow there. They're going to ask you if you have a family history of vein problems or a previous history of vein problems like blood clots, phlebitis, etc. Now, on physical examination, the doctor is going to look for swelling, visible varicose veins, skin discoloration, spider veins, signs of phlebitis, or even open sores and wounds. Sometimes just the appearance of the legs gives us a strong clue. For example, myself, I have so much expertise in this area. I've been doing it for so long. I can take one look at a patient and tell them for sure whether they have venous insufficiency and chronic venous disease right off the bat, especially in advanced cases. Sometimes when people come with very early venous disease and just symptoms. So the next test that you would need would be a duplex ultrasound. This is the gold standard for testing for chronic venous insufficiency. It's non-invasive, it's painless, it uses inaudible sound, the same kind of test that you would get a sonogram that ladies get in pregnancy, or an echocardiogram that we use on the heart to check the heart function and the function of the valves, etc. This is ultrasound technology, which is quite remarkable. And with this test, we can see whether the valves in your veins are working or whether blood is flowing backward and pooling in the leg. We can also see if there's any blood clots, and we can also see if there's any history of former blood clots that might show scarring and valvular deformity. So this duplex ultrasound, besides making the diagnosis, also helps us map out which veins are affected, and that's very crucial for proper treatment planning. The next thing we want to do is rule out other causes, because remember, not all leg swelling is venous disease in nature. There are also other things that a good doctor has to consider. They want to consider heart failure when the heart can't pump effectively or when you have bad valves in the heart. A very common question I get is, are my heart valves associated with my leg vein valves? And the answer typically almost always is no. They're both valves, they're both delicate, and they can both fail, but they're very much unaffected by one another. The other problem that your doctor wants to rule out is either kidney or liver disease. Both of these things can cause significant fluid retention. Another subject that we've talked a lot about on my channel is lymphedema. That's the third part of the circulation. Remember, we have the arteries, we have the veins, and we have the lymphatic vessels. And lymphedema is a different condition where lymphatic fluid builds up, but it can be associated with vein problems. When the veins aren't functioning properly, fluid can build up in the legs, overwhelming the lymphatic channels and cause lymphedema. So we call that phlebolymphodema, or vein problem that leads to lymphedema swelling in the legs. All of this is why it's so important to get a really thorough evaluation by a really good doctor who really knows a lot about this disease. Let me give you an analogy about the duplex ultrasound. Think of it as a traffic camera that is checking your system of veins. It lets us watch the blood flow in real time, just like you could watch cars moving in the traffic in real time. And it tells us if the traffic is moving in the right direction, or if there are any cars going the wrong way down the street, or whether there's a traffic jam somewhere along the road. A key takeaway here is that diagnosis is simple, it's non-invasive, and it gives us all the information we need to create a personalized treatment plan for each and every patient. If you're noticing persistent swelling or visible veins, an ultrasound can tell you exactly what's going on underneath the surface. Now let's talk for a few minutes about the treatment options. The good news is that venous insufficiency is highly treatable, and the right approach depends on how severe your symptoms are and how much your condition is affecting your daily life. So let's break down the main options. First, we have lifestyle and conservative care. These are often the first steps, and they can make a big difference. We begin with compression stockings. These are specially designed socks, stockings, or even pantyhose that gently squeeze your legs in what we call a graduated compression system. Greater pressure at the ankle and less pressure as you go up. That creates a gradient that wants to encourage blood to get back up toward your heart. Graduated compression stockings don't cure the problem, but they do relieve symptoms in a lot of patients, and they can help with signs like swelling as well. Think of them like a scaffolding for a weak building. They support the structure so it doesn't collapse under pressure. Ideally, graduated compression stockings should be worn daily and definitely should be fitted properly by an expert for the best results. These are different than just leggings or some kind of a compressive sleeve. The graduated compression with different pressures along the length of the garment are very, very important. And this is why they can be quite pricey, because the technology that goes into making them is really very, very advanced. And quite frankly, cheap kind of junky pairs are probably just a waste of your money. So you should invest in one of the good manufacturers, and there are many out there, but try to avoid the cheapos. It's just throwing money down the drain, actually. You'd probably be better off with nothing. Now, the other thing that you can do conservatively is raise your legs above the level of your heart for 15 to 20 minutes, especially in the evening. But if you have the luxury of doing it a couple of times a day, that's even better. That helps the blood drain from your legs back to your heart. And this is a really simple thing to do. What I advise patients is that you have to lie flat on your back and then raise your legs so that your feet are above the level of your heart. Sitting in a chair with your legs extended on a hammock or a coffee table, that's not going to do the trick, because your right atrium, the right side of your heart, is still above your ankles. So you won't get any decongestion just by lifting your legs up. The great thing about leg elevation is that it's simple, it's free, and it's very effective. It's not going to be permanent, but it can give you temporary relief. You may feel better with elevating the legs, and the swelling can improve. The The other thing that, of course, we always recommend is exercise. And as everybody knows on my channel, walking is my favorite exercise for anybody who can do it. But cycling, other simple things like calf raises that strengthen your calf muscles and move blood and act like a natural pump is also very good. Even light activity improves circulation compared to sitting or standing still for hours. And that includes simple things like housework or gardening. Anything that keeps you on the move is going to promote blood flow out of the veins and back up to the heart. And of course, as we always talk about, we all want to work hard on weight management. The less abdominal girth we have without that large abdominal fat pressing on the organs and on the vena cava and the iliac veins, the better. So losing excessive weight reduces pressure on the intra-abdominal veins, and that gets transmitted into less pressure into the leg veins. Even modest weight loss can improve symptoms. 5 pounds is meaningful. Then we come to minimally invasive procedures. When lifestyle changes and stockings just aren't enough anymore, doctors can actually fix or close off the problem veins using modern techniques. And this is a big change over where it used to be. The first technique to talk about is endovenous ablation. One is thermal ablation. That uses either a laser or a radiofrequency device. And that basically cauterizes the lining of the vein. And basically, I call it heat shrinking that vein. We close it, as opposed to in the old days, we used to have to do the stripping procedure, which many of you have probably heard of. You may have had it, or you had relatives who had it. It was quite aggressive and quite brutal, quite frankly. It was done in the hospital under general anesthesia. People would often spend a week or so in the hospital. They'd be out of work for 6 to 8 weeks. There was a lot of blood loss. It was very painful. And thank goodness this has been replaced with modern techniques. And those modern techniques allowed me to reinvent my career as a cardiac surgeon to becoming a vein specialist, working in the office in an ambulatory center where patients could come in, have their procedure, walk out wide awake, and go home and go on with the rest of their day, similar to going to a dental visit. In endovenous ablation, a very tiny catheter, think of something that looks like a cocktail straw, but very, very long, is placed inside the faulty vein. And that little catheter, that little cocktail straw, is used to introduce either a laser fiber or a radiofrequency fiber, and it passes through, allowing the tip to extend beyond the end of the catheter, where the heat energy can be transferred. That heat energy then sequentially seals shut the bad vein as we slowly withdraw it out of the vein. So typically we start high in the thigh and we pull that catheter back, and beep, 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 a millimeter at a time, we close that bad vein using thermal energy, or basically heat. And it's like cauterizing that vein and shutting it down so that the blood can no longer travel backward in it. You never have to worry about getting rid of that vein because it's a bad vein. It's a diseased vein. It's a question I get all the time. Doctor, if you get rid of that vein, how will my blood flow? Well, remember, that vein is not functioning properly. It's not taking blood out of your leg back to your heart. It's allowing blood to pool in the heart. So that's a big problem. It would be like taking out an infected gallbladder or an infected appendix. My appendix was taken out when I was 16. It was ruptured. I had peritonitis. I had an abscess, and my appendix almost killed me. Thank goodness I survived. But getting rid of a bad vein is just like getting rid of any other diseased organ. You don't get worse, you get better. And by doing that, the blood gets naturally rerouted to so many other normal veins that you have in your lower extremity, that you have in your leg. So your circulation is sure to improve. These procedures are done under local anesthesia. They're relatively quick. They take about 30 to 35 minutes, generally speaking. There's 0 to minimal scarring, maybe a tiny little scar where the catheter enters the skin of the leg, but it's a fantastic procedure, and it's been a game changer in the last 20 years in the United States and around the world for people with venous insufficiency. The next procedure is something called sclerotherapy. Sclero just means scarring, therapy means treatment, and this is where a chemical solution or a medicinal pharmaceutical solution is injected into veins to close them down. This can be used for tiny spider veins. It can also now be used for larger varicose veins. And most commonly today, we use a kind of detergent or a soap sud solution. You'll hear it referred to as foam. And that foam fills up the vein. And just like when you're a kid and you get shampoo in your eyes and it burns your eyes, the same thing happens inside of the vein. That medicine burns the lining of the vein with a medicinal burn rather than a thermal or a heat burn. And for the right veins of the right size, in the hands of an expert like myself and many others who are out there, you can close many bad veins very, very easily just with a few little injections of that very effective medication. It can also be used for cosmetic concerns for smaller thread veins or spider veins on the surface of the skin. Another procedure that we use routinely, especially those of us who are surgeons and feel comfortable operating, is microphlebectomy. Micro meaning tiny, phlebectomy meaning removal of a vein. And tiny doesn't refer necessarily to a tiny vein, it refers to a tiny incision. So we make a tiny incision in the skin under local anesthesia, and using a very delicate little hook we call a vein hook, we can pull that vein up through that tiny little incision, and believe it or not, we can remove long lengths of diseased vein through tiny 2-3 millimeter incisions. It's a game changer. When I was a resident many years ago, we used to make big incisions and use big ugly stitches and staples to close those incisions. So things have absolutely improved dramatically. It's almost like science fiction. In fact, many of my old general surgery and vascular surgical professors came to my center over the years to train with me when they found out that I was specializing in this field. And they would say to me, "John, I can't believe my own eyes. If I didn't see it with my own eyes, I couldn't believe that you're doing these procedures under local anesthesia, no sedation, in the office with tiny incisions, essentially no blood loss. It's incredible." So it has been an absolute game changer. And we're also blessed to live in a golden age where healthcare and medical care is improving at unbelievable rate of speed. So these are outpatient procedures, and they're these micro incisions which typically in my patients leave no scarring whatsoever. If anything, you may have some little spots that look like freckles. Surgical options are very much less common today, and I really haven't done a vein stripping or what we call a high ligation in almost 20 years. If somebody recommends to you a vein stripping or a high ligation, especially if it's going to be done in the hospital under general anesthesia, I would definitely suggest that you go and get a second or a third opinion before proceeding with a major operation like that, because they are almost never indicated in modern medicine. Just to review, that was where the vein was literally pulled out or torn out of the leg in the hospital under anesthesia. And like I said, it was a very, very traumatic procedure, and there's essentially no need for it anymore. Those procedures have been replaced by these less invasive, minimally invasive office-based procedures. Now, in terms of anything that you could take by mouth, there are definitely no pills that cure venous insufficiency, but there are some supplements that we call venoactive agents or venoactive compounds. And one of them that I'm a great believer in is micronized purified flavonoid fraction. The MPFF, we call it, supports normal venous and lymphatic function and also supports healthy microcirculatory function. For full disclosure, my company VitaSupport MD makes several supplements with MPFF as the key ingredient, and I encourage you to take a look at it for supporting vascular health, circulatory health, and venous and lymphatic health. Here's the key takeaway. Most patients today can be treated with a combination of conservative measures and quick outpatient procedures, and these approaches really can relieve symptoms, improve appearance, and most importantly, prevent long-term complications of untreated venous disease, including cellulitis, bleeding, infection, sepsis, deep vein thrombosis, phlebitis, non-healing wounds, and more. For another analogy, think of venous insufficiency like a traffic jam on the highway. Compression stockings are like traffic cops keeping the cars moving in the right direction. But if a major road is permanently blocked, sometimes the best solution is to close it off and reroute the traffic to healthier roads, which is exactly what procedures like thermal ablation and medical chemical ablation and sclerotherapy do. Let's talk about the complications of venous insufficiency if it's left untreated. Unfortunately, even now, even some doctors believe that varicose veins or leg swelling is just a cosmetic issue, and it's something that you just have to live with. But untreated venous insufficiency can cause serious complications over time. You can take it from me because I've seen them all, I've treated them all, and I've helped patients deal with and overcome every single one of these complications. So here's what can happen if the condition progresses. Number one, you can get chronic swelling and pain. As the pressure builds up in the veins, we develop what's called venous venous hypertension, and swelling can become constant. This can overload the lymphatic system, and you can also develop phlebolymphedema. The legs can feel heavy, achy, and tired all the time, which can lead to a limited ability to perform your daily activities and decrease your mobility. I can't tell you the number of patients. I just had one recently, a lady in her 70s, who was able for the first time in years to go with her daughter and her grandchildren to Disney World and walk all over the park without trouble and not have to stop and rest, not have to sit and recover. And she was so thankful for treating her veins. The other thing is the skin changes. Long-term pressure causes skin damage, and it can cause scarring of the underlying tissue. It can cause open ulcers around the ankles, and this can lead to infection, cellulitis, and even in the worst cases, sepsis. It also causes tremendous disfigurement of the leg. The other symptoms that people get that can be chronic and very debilitating and very aggravating is itching and burning because of the constant irritation and inflammation. Of course, you have the venous leg ulcers, those open wounds that we talked about, and this is one of the most serious complications. These are painful, they can be non-healing, they can sometimes take months or even years to heal. Sometimes they don't heal at all. They can sometimes take very aggressive means to heal them, even after all of the venous insufficiency has been treated. Sometimes they require skin grafts, biological dressings. It can be a real disaster. And when left open for a long period of time, if non-healing, it can lead to something called osteomyelitis, which is an infection of the bone itself. And this can be a very, very hard thing to eradicate. The other thing to know about chronic non-healing wounds like venous leg ulcers is that chronic wounds can even develop cancers in them, like squamous cell carcinoma commonly. So if you have a long-standing non-healing venous leg ulcer and you're under the care of somebody, either a vascular surgeon, a primary care doctor, or even in a wound center, if that wound hasn't healed in months or, God forbid, years, make sure your doctor performs biopsy to make sure the reason it isn't healing is because there's cancer in that wound. I have seen that over the years, unfortunately. Venous leg ulcers require specialized wound care and, of course, treatment of the underlying venous disease. And unfortunately, they can be recurrent and they can return. They can be a really hard long-term chronic problem. So that's why we want to avoid them at all costs and treat this disease early. The other problem with venous insufficiency is skin infections. Constantly swollen and irritated skin is more prone to infections like cellulitis. Repeated infections further weaken the skin and the circulation, and it becomes a vicious cycle. The other thing that happens with long-standing venous insufficiency is a reduced quality of life. Beyond the physical symptoms, venous insufficiency can affect confidence, mobility, independence, and even interpersonal relationships. Imagine having a non-healing wound of your leg and trying to carry on a normal, intimate relationship. It's a very, very real and serious side effect of long-standing venous insufficiency, also in terms of feeling of attractiveness, etc. So there are many aspects to this, not all physical, some psychological and emotional, which is very understandable. Also, many patients will stop exercising, socializing, or wearing certain clothes, which can impact both physical and mental health. A plain English analogy is think of your veins like a dam holding back water. If that dam keeps breaking and leaking and nothing's done, eventually the water erodes the land, floods the area, and causes permanent damage. In your legs, that flooding shows up as ulcers, infections, and chronic pain. The key takeaway is that venous insufficiency is not just about appearance. Leaving it untreated can lead to painful, disabling, and even dangerous complications, but with early diagnosis and treatment, most of these outcomes are completely preventable. So let's bring this all together. It's been a really long session, and this is my area of expertise, so I've shared a lot. We've gone deep. We've really gotten into it. Chronic venous insufficiency is far more common than most people realize. It's not just about varicose veins or cosmetic changes. It's about circulation. It's about your vascular health. When the valves in your veins stop working properly, blood pools in your legs, and instead of flowing back to your heart, it just pools and pools and pools, causing all kinds of complications in terms of your leg health. We've covered what venous insufficiency is. It's a problem of weak or damaged vein valves. We've talked about the causes and risk factors like genetics, age, pregnancy, obesity, long hours of standing and sitting, and the history of blood clots. We've talked about the symptoms of swelling, heaviness, aching, varicose veins, skin changes, and ulcers in advanced cases. We've talked about the diagnosis, which is simple. It requires a good history and physical and a simple ultrasound test to confirm what's going on. The treatment options Options range from compression stockings and leg elevation with lifestyle changes to modern, minimally invasive procedures that can close off bad veins and reroute blood to the healthier ones. There are complications if this is left untreated, including ulcers, infections, and of course, a significantly reduced quality of life. And remember, the one most important lifestyle change I mentioned at the beginning is that you've got to get moving. You've got to start walking. Something simple as 20 to 30 minutes a day. Start with 5 if you have to. Start with 1 walk around the block if you have to. But that activates that calf muscle pump, improves your circulation, reduces swelling, and slows disease progression. No medication, no surgery, just movement. The bottom line, venous insufficiency is treatable, it's serious, and the earlier you act, the better your results. If you notice swelling, heaviness, or veins that are changing, do not dismiss it. Talk to your doctor and get evaluated. If this video was helpful, share it with somebody who's struggling with leg swelling or varicose veins, and please let us know in the comments. Have you ever noticed these symptoms in yourself or a loved one? Have you ever had treatment? What was your experience like? And don't forget to subscribe for more evidence-based health content, because healthy veins mean healthy legs, and taking care of them today keeps you active for your entire life. I'm Dr. John Chuback, board-certified cardiovascular surgeon and vein specialist, and I will see you in the next video. Thanks so much.